Students, good afternoon. Slides are visible. क्या लिखा है स्लाइड पे? लंच नहीं किया ना अभी? So the topic is health assessment, in which we're going to discuss about the purposes, preparation, and methods. So the next part is already being discussed in the morning session about the competencies of the health assessment. But now we're going to discuss about what is the health assessment, what are its purposes, preparation, and methods. Next slide, please. Next slide, please. Health assessment. What is health assessment? Health assessment is the systemic method of collecting the data of the patient, and we need to analyze that data about the patient's health status through the patient's history, physical examination, and observation in order to identify the actual and potential health problems which are needs to establish the baseline data and plan the appropriate nursing care. So बेसिकली हेल्थ असेसमेंट वो होता है जिसमें हम डेटा कलेक्ट करते हैं, पेशेंट को असेस करते हैं सब्जेक्टिवली भी और ऑब्जेक्टिवली भी, उस डेटा को एनालाइज करते हैं और एक कंक्लूजन पे आते हैं कि व्हाट इज द एक्चुअल प्रॉब्लम और व्हाट कैन बी द पोटेंशियल हेल्थ प्रॉब्लम्स की आगे क्या हो सकता है. सो उसको हम आइडेंटिफाई करते हैं एक्चुअल और पोटेंशियल प्रॉब्लम्स को, और ये हमें एक बेसलाइन डेटा प्रोवाइड करता है. ऑन द बेसिस ऑफ दैट वी आर प्रोवाइडिंग द appropriate nursing care. Next slide, please. Purposes. What are the purposes of health assessment? Why the health assessment is being required? क्यों करते हैं हम हेल्थ असेसमेंट? टू एस्टैब्लिश द बेसलाइन डेटा कि हमको जो भी नर्सिंग केयर प्रोवाइड करनी है उसके लिए हमें पेशेंट के स्टेटस का एक बेसलाइन डेटा मिल जाता है. नेक्स्ट इज टू आइडेंटिफाई द एक्चुअल एंड पोटेंशियल हेल्थ प्रॉब्लम्स. पेशेंट को एक्चुअली क्या प्रॉब्लम है और आगे क्या प्रॉब्लम हो सकती है. दैट इज व्हाई वी आर डूइंग द हेल्थ असेसमेंट. To identify patient strength and coping ability. पेशेंट कितना टॉलरेट कर सकता है, क्या क्या पेशेंट की स्ट्रेंथ है और कितना पेशेंट कोप कर सकता है विद द डेली एक्टिविटीज ऑफ लिविंग. To support the accurate nursing diagnosis and care planning. With the health assessment we need to know हेल्थ असेसमेंट के बेसिस पे, क्योंकि जो भी हमने सब्जेक्टिव ऑब्जेक्टिव डेटा कलेक्ट किया है उस बेसिस पे वी आर बिल्डिंग द नर्सिंग डायग्नोसिस, और उस नर्सिंग डायग्नोसिस के बेसिस पे वी आर प्लानिंग द केयर. टू इवैल्यूएट द आउटकम्स ऑफ नर्सिंग केयर. आपका नर्सिंग केयर कितना इफेक्टिव रहा उसको हम इवैल्यूएट करते हैं विद द हेल्थ असेसमेंट. To detect the risk factors and promote the health education, and to identify the need for the referrals or further investigation. जो भी आपने असेसमेंट किया उस असेसमेंट के बेसिस पे अगर यू नीड कि लग रहा है आपको कि इसी रेफरल की जरूरत है या फर्दर इन्वेस्टिगेशन करानी है, देन वी कैन प्रोसीड फॉर द फर्दर इन्वेस्टिगेशंस. फॉर एग्जांपल एक पेशेंट आता है फीवर के लिए, आप उसका टेस्ट हुआ होता है सीबीसी का, उसको आपको कुछ क्लियर पिक्चर नहीं मिल रही है विद द रूटीन. सो यू मे आस्क और डॉक्टर में आस्क फॉर द फर्दर इन्वेस्टिगेशंस कि क्या क्या हो सकता है. इट मे गो फॉर द वायरल टाइटर्स के लिए जा सकते हैं, एलएफटी के लिए जा सकते हैं, यूरिन माइक्रोस्कोपी रूटीन करवा सकते हैं. सो फर्दर इन्वेस्टिगेशंस मे रिक्वायर. नेक्स्ट स्लाइड प्लीज. Preparation for the health assessment. what preparation do we require for maintaining the health assessment or doing the health assessment? Number one is the environment. So, how the environment is being responsible for the health assessment? So, first of all, the environment should be quiet. It should be well lighted. It should be private and comfortable for the patient. पेशेंट को हमने एक कंफर्टेबल एरिया प्रोवाइड करना है, पेशेंट को एक प्राइवेट उसकी प्राइवेसी को मेंटेन करते हुए एग्जामिन करना है, वहां पर लाइटिंग प्रॉपर होनी चाहिए और वो एरिया क्वाइट होना चाहिए. Next is the equipments. All the equipments required for the health assessment like stethoscope, sphygmomanometer, that is the BP apparatus, thermometer, tongue depressor, gloves, pen light, measuring tape, cotton swabs, otoscope, proctoscope, any other thing or any relevant thing which are being required according to the systematic examination. Next is the nurse preparation. Being a nurse, we also need to prepare, right? We need to maintain the hand hygiene, wear the gloves, the uniform should be clean. We need to use the PPE, establish the rapport, and we need to explain the procedure to the patient. Ki now we are going to check for the health assessment or we are assessing your health. Next is the patient preparation. For the patient preparation, we need to provide privacy, proper positioning, draping, reassurance, and the informed consent has to be taken care of in the patient preparation part. Next is the psychological preparation. We need to tell the patient that we are going to do the health assessment, so you need to reduce your anxiety, encourage for the cooperation, and maintain the dignity. Next slide, please. Methods of health assessment. In the methods of health assessment, we are discussing the four methods: inspection, palpation, percussion, and auscultation. Next slide, please. Inspection. Inspection slide. In the inspection, what is the inspection? It is the visual observation. जो भी हम आंखों से देखते हैं, observe करते हैं about the patient's body and behavior is the inspection. Inspection जो होता है वो हम perform करते हैं in a systematic manner, in a head to toe or system wise, which requires a good lighting, sometimes use of pen light or magnifier. For example, when we are assessing for the skin color, body posture, wounds, symmetry, or respiratory effort. Next slide, please. Palpation. Palpation we are using with the hands or fingers to feel the body surfaces. It determines the temperature, texture, moisture, tenderness, masses, or the organ size. It is hepatomegaly or splenomegaly or any kind of vibrations. There are two types of palpation: light palpation and the deep palpation. Light palpation we use to assess for the surface features or assess the tenderness. For the deep palpation, we need to assess the internal organs like liver or kidney as for their sizes. For example, palpating the lymph node or palpating the abdomen or even the pulse checking is a kind of a palpation. Next slide, please. Percussion. Percussion is the body parts with the fingers to produce sounds. How do we produce the sound percussion? Like this. ऐसे करके we need to tap. It helps to determine the size, consistency, or the borders of the organ. It helps to detect the presence of the fluid or air in that cavity or the organ. There are types of percussion sounds, like there is a resonant sound for the normal lung tissues. There can be some hyper resonant sound for the overinflated lungs or in case of emphysema. There could be dullness sound for the solid organs like liver. There is a flattening sound for the bones or muscles, or tympani, that is the air filled in the stomach or the intestine. Next slide, please. Auscultation. Auscultation is the listening of the sound produced by the body organs with a stethoscope. It helps to assess the functions of heart, lungs, abdomen, or blood vessels. For example, we are auscultating the heart for the S1, S2 sound, that is a loved up sound, murmurs. For the breathing sound, it is normal or wheezing sound or stridor or rhonchi, crackles, or any other lung sound. Bubble sound for the peristalsis, or if in case of diarrhea, hyper sounds हैं कि hypo sounds हैं. And the bruits in the arteries. This bruit we used to assess in the AV fistula. So that was all about the methods of health assessment. Any questions? Thank you.
Thank you so much, Dr. Alisa Talwar, ma'am, for your insightful and enriching presentation on health assessment purposes, preparation, and methods of assessment. Your words have added great value to this session and given us so much to reflect upon in the field of nursing education. Nextly, we are moving on. Now we moving ahead to our next enlightening session. I take the privilege to invite Dr. Swati Patanbal, ma'am, Associate Professor, Government College of Nursing, Jalon, to kindly deliver her session on Introduction, Principle, and Legal Perspective. We warmly welcome you, ma'am. So, very good afternoon to all. I would like to thank Dr. Shivraj sir for giving this opportunity to stand here and present my topic. So, my topic is introduction of first aid. If you see, first matlab pehla, aid is our action. So by name itself, if you see what is first aid, first aid is the first action we are taking as a part of treatment, as a part of giving medicine to the patient. So immediate assistance or immediate care, that will be called it as a first aid. So as per maybe many of semesters have already studied about first aid, immediate care, immediate what action we are taking when we are seeing a patient injured or harm. तो हम लोग नॉर्मली घर पे भी बाहर भी कहीं जा रहे हैं, रोड में एक्सीडेंट हो गया है, कोई एकदम साइकिल से गिर गया है, आपने क्या किया, उसको उठाया और पूछा, क्या पूछा, कैसे हो, ठीक हो, चोट लगी. So what we are asking, whether there is any problem, harm. So what we are doing? We are first asking. So ask for help. That is from the patient or from the client. So first aid, पहला action आपने क्या किया. दूसरा, अगर वो आपको रिस्पॉन्ड नहीं कर रहा है, बहुत शॉर्ट में मैं बताऊंगी, अगर पेशेंट आपको रिस्पॉन्ड नहीं कर रहा है तो आप क्या करते हो, नेक्स्ट स्टेप आप उठाते हो. वी विल गो फॉर द असेसमेंट. व्हाट वी आर डूइंग, असेसमेंट. आपने क्या किया, वाइटल्स चेक किया, क्यों रिस्पॉन्ड नहीं कर रहा है, वेदर रेस्पिरेशन, ब्रीदिंग, और पेशेंट रिस्पॉन्ड आपको दे रहा है, नाम क्या है, कहां से आए हो, जेब में कुछ मिल रहा है, इमीडिएट यू विल check. So this is all about general introduction about first aid. If you see, the first aid is an immediate care given to the person or a victim. Victim कौन है यहाँ पे, जो sufferer है, जो जिसको harm हुआ है और जो already injured है. So any type of minor and major accidents भी होते हैं. जैसे छोटी सी घर में चोट लग जाना, किचन में आप खाना बना रहे हो और ऐसा आप चल रहे हो, आपका पैर मुड़ जाना, वो भी एक फर्स्ट एड. सो माइनर एंड मेजर कंडीशंस आते हैं. खाना बनाते हुए हाथ जल गया, कौन से टाइप का बर्न हुआ है. सो बर्न में आप क्या इमीडिएट एक्शन लोगे, इमीडिएट पानी में हाथ डालोगे या उसमें आइस क्यूब्स लगाओगे. दिस इज ऑल्सो फर्स्ट एड. सो फर्स्ट एड, फर्स्ट एक्शन टू एवरी इंजर्ड, एवरी हार्मफुल, दैट इज कॉल्ड एज फर्स्ट एड. कंसेप्ट क्लियर. So next slide please. Purpose of first aid. तो आप इफ यू आस्क अबाउट क्या इसका पर्पस है, सो पर्पस क्या हो सकता है? टू सस्टेन लाइफ, जो इंजर्ड है उसको सस्टेन करना और सफरिंग को प्रिवेंट करना. प्रिवेंट, प्रिजर्व, 3 P's you always keep in mind for purpose of first aid. बहुत इजी वे में P क्यूब हम कहेंगे. तो P क्यूब में prevent, promote and preserve. So these are the 3 P's that you keep in mind for the purpose of any type of first aid care or purpose of first aid. Next slide, please. So what is first aid? That we have already discussed. Objectives, please. Next slide. Objectives. So to preserve and prolong life. If we are not providing care, not taking immediate care, patient will get infection, patient may get more harm, and it will not get recovered. So this is the objective. Preserve life, alleviate suffering, or prevent from us suffering. That is the main. Or any infection patient को हो सकता है in future if we are not curing today itself. और अगर bleeding बहुत ज़्यादा हो रही है तो patient may get harm and vitals may get affect. So if अगर कोई और जैसे आपकी breathing difficulty, suffocation हुआ है और drowning हो रही है या फिर there is problem with the respiratory tract, तो हम लोग उसमें क्या check करते हैं? DRABC. What is D? DRABC, anyone? DRABC is danger. R for response. A for airway, breathing and circulation. So that all things we are checking. DRABC, that is we are calling it as a DRABC. So please move towards the principles of first aid. Principle slide. Slide change. Principles are call for help. If patient is suffering, we have to call for help. Calmly take charge, or we have to ask. So consent is too important. If we see the principles of first aid, calmly we have to not to rush. सबसे ज्यादा क्या होता है जब हम कोई पेशेंट ब्लीडिंग होता हुआ देखते हैं या सडन गिर जाता है, बहुत बड़ा कोई स्टैब इंजरी हुई है, एक्सीडेंट हुआ है, हम भी रश करते हैं. वी आर ऑल्सो अब क्या करना है. सो डोंट बी पैनिक. दैट इज द सेकेंड प्रिंसिपल. एंड चेक फॉर द scenes or casualty if there is patient is responding or not. अब पेशेंट से ही पूछना है आपका नाम क्या है, आप कहाँ से आए हो. अगर पेशेंट रिस्पॉन्ड नहीं करना है देन वी हैव टू मूव टुवर्ड्स द अदर फर्स्ट एड. एज ए मेडिकल प्रैक्टिशनर we are always licensed to do or give first aid, but if we are not, then also we are a first aider. So we have to take a consent. That is another legal aspect of first aid. Everyone can't give a first aider care unless and until they have no authority to give treatment or medicine or any type of. We are only a supporting to the casualty, or we are only support to the injured or there is person. So what are the principles or do's or don'ts in first aid? What we can do and what we can't do for the first aiders. So principles, please. Next. So do stay calm. Don't get panic in any type of situation. If you handle a first aid or immediate action, you have to take care. Do reassure or comfort patient को भी आपको खुद संभल के patient को समझाना है कि आराम से relax. We are on the process. We have called ambulance. They will come and they will receive you. Relax. आपको कहाँ दर्द हो रहा है, क्या चोट हो रही, if you have some, if he is or she is conscious, then keep victim covered to reduce shock or loosen tight coating. Any type of clothing or any type of bracelets and all, everything, if she or he is wearing, then we have to make sure that they should get comfort. Then don't. What we can't do, that is give food, drinks or unconscious patient है तो क्या होगा? As a nursing professionals, we are knowing unconscious patient अगर कुछ खिला पिला देते हैं, what is happening? It is giving trap to the respiratory system and it will get aspirated. Maybe it will go to the trachea. So what first we are doing? We are giving a sideline position. So he will or she will not get aspirated. Next, don't move for injured person place to a रुक. बहुत जरूरी है उसको comfortable position देना और safe place में ले जाना. बीच रोड में अगर एक्सीडेंट हुआ है तो आपको साइड रोड में ले जाना है और उसको straight comfortable position पहले देना है. then only we are going to assess the vital signs. Then if we see the characteristics हमारे अंदर अगर as a first aider we are first aider, what are the characteristics? Are observer, resourceful, gentle or sympathetic. These are the nursing qualities that all we are following, we are trying to keep in our personality. Then these are the other qualities. And role of first aider is the medical assistance and medical call help numbers you should have. So what is the immediate take action if the person is not responding to you? वो सांस नहीं ले रहा है, बात नहीं कर रहा है, आवाज दे रहे हो, सुन नहीं रहे हो, आपने क्या किया? शेक किया, शेक करके उसको हिला के देखा, but he is not responding. So now next, when we feel that it is not our control, हम इसको control, then we will go for the referral services. So then these are the general responsibilities we can do. So don't, if you see, if you are feeling it is as कि उसका vitals नहीं है, उसका temperature, pulse, respiration, and patient is not responding, you are trying to take a heart that is pulse भी उसकी नहीं मिल रही है, you have no authority to declare it as a death. You have to take immediately with the ambulance to the hospital, and doctors are have authority to get after a physical examination. Then prescribing medicine is also immediate, not needed. कि आपने देखा कोई ब्लीडिंग हो रही है, आपने जैसे घर में हम लोग करते हैं, मरिक्रोक्रॉम उठाया और ग्लिसरीन उठाई और बैंडेज कर दिया, मैंने ड्रेसिंग कर दी. As we are nursing professional, nursing students, हम ये रोज करते हैं, हॉस्पिटल में यहाँ भी कर रहे हैं. So we should not do unless and until we are not legally authorized. So these are the certain things that we have to keep in mind while doing a care or while giving a immediate first aider management to any person. Please come to the slide of first aid kit. So what all things will be present in the first aid kit? आपने first aid kit एक object box बनाया होगा. First aid में first semester students are making. That is in the project part. First aid kit में क्या क्या होना चाहिए? Certain medications का एक part होता है, certain bandages types होते हैं, and certain ointments होते हैं. And with this they are having a like other instruments, torch, thermometer to see any visualization of any eye or any dilation, and gloves and scissor for cutting, and adhesive plasters for taking a bandage to the up to stick, or splints to take or push or provide a fracture. अगर किसी का fracture हुआ है या hand and limbs are being affected, we are providing a splint. So these are the certain first aid items that we can use for the management of the first aid. So complete to the action plan, please. So action plan is first and foremost thing what we are doing, assess the situation. What is it happening and what is the situation. Then comes to, we have to make calm to yourself, safety to casualty and safety to ourselves. By safety ourselves में हमारा क्या आएगा? What is that we will see in proceedings link, that is legal things that we are seeing. Assessing casualty and treating casualty. Assessing का मतलब है कि हम लोग DRABC जो है उसको हम assess करेंगे, और treating का मतलब है we will plan other next action towards until and unless the ambulance is coming, or until and unless the patient is going to the hospital. So these are the things that action plan. You will get check for the danger, check for the airway, then DRABC, that is danger response, airway, breathing, circulation. So here danger to yourself and to others, that we have to see how we are protecting ourselves when we are treating. We have to take a consent from the patient. If patient is responding, you have to see that patient may ask you. So there are certain types of consent जो legal implications कहता है, or legal perspective in first aid. We can't go directly and take a hand and we will bind a bandage. अब मैंने इसको ठीक कर दिया. So we have to take a consent from the patient. If tomorrow he or she is having any type of infection or any abnormality, any sensitivity, what medicine you are giving, then you are responsible and your registration will be getting cancelled. So we have to aware of that. That is a legal implications or legal perspective that we will see in proceeding slides. So response, what response we will casualty? Obviously consciousness, whether he or she is conscious or not. Or एक होता है conscious, एक होता है semi-conscious. So semi-conscious is like drowsy. half name he is saying and halfly he is not able to say. So reactions and non-reactions also, some consents are like patient are asking कि मेरी हेल्प कर दो मुझे चोट लगी है, that is patient acknowledging consent. एक होता है consent that आप ठीक हो, आपको कुछ किसी चीज की जरूरत है, so patient is saying yes, then we can go for that is another consent. So airway, breathing, circulation, and these are the techniques that we are seeing. Breathing, circulation we are seeing for the pulse and heart, apical pulse, or normally we are saying, then go for the radial pulse. Secondary, we will check. And the legal perspective in first aid is the good Samaritan principles. Samaritan principles क्या होता है? That we are doing a legal perspective for it. So what social service, what from goodwill we are, from heart we are doing care to the first aider or needer, जिसको जरूरत है उसकी care करना. So here we have already seen the introduction part, principles, preserve, and everything. Then who is first aider? First aider, anyone who is simple and very simple, diagnose and able to treat the injured. जो भी फर्स्ट केयर, फर्स्ट एक्शन, फर्स्ट एड कंडीशन में या इंजुरीज पेशेंट को दे रहा है उसको हम फर्स्ट एडर कह सकते हैं. सो फर्स्ट एडर क्या क्या कर सकता है? कैजुअलिटीज को प्रिवेंट कर सकता है, प्रोटेक्ट कर सकता है. 3 P's वी कैन प्रोवाइड: preserving life, prolonging life, and promoting life. So bedside first aid, whatever care we are giving, that the first aid. So first aid and the laws. Now comes to perspective, legal implications. What we are not knowing till now, we have studied about the first aid and all the things like stroke, like burn, like drowning, like any type of injury, foreign body, these are all comes under first aid. But who can do and what will be the circumstances if the patient is not allowing you to give care? So there are certain rights in nursing. You have might be knowing the medication rights: right time, right dose, right drug, right route, and right to refuse. So right to refuse your care also one right of a patient. If emergency condition also patient is not allowing you to touch or allowing you to give care, you can't give care to the patient. So consent is the more important for yourself and for our safety, the first aider. So next is there is a right to provide assistance, Good Samaritan law, that is Motor Vehicle Act in 1988. It is amended, that providing emergency care in good faith without expectation of reward. So this is the act that is amended in 1988. Accordingly, it is bystander or first aider, legally they are protected if they are giving unsocially or they are giving without any expectation, giving care to anyone. So we, according to this law, good Samaritan principles are like legal obligations are there, certain principles like consent. So certain consents are there which we have to take from the client. That consent is the permission from rendering care to the specific person. So consent में मैं ज़्यादा नहीं जाऊँगी. First consent है, that is expressed consent. Expressed में patient acknowledge करता है, वो खुद आपसे help मांगता है. That are express consent कि मेरी ये दिक्कत है और मुझे यहाँ दर्द हो रहा है, मेरी हेल्प कर दो. That is the express consent. Then comes to implied consent, that is unconscious patient. अगर कोई पड़ा है और आपने immediate उसकी हेल्प करने की सोची है, तो that will comes under implied consent. Then comes to implied consent में क्या होता है कि अगर उनके साथ कोई रिलेटिव है, तो आप उनसे उनकी परमिशन ले सकते हैं कि आपको जरूरत है, क्या मैं इसको ले जाऊं. So involuntary consent is for the mentally ill. अब छोटा बच्चा है, गिर गया, चोट लगी है, पर उसके आसपास कोई नहीं है, so it will be comes under involuntary consent. Or any abnormality like mentally retarded patient, they are not able to answer, they are not able to understand whatever you are doing. So developmentally delayed person होते हैं, that will comes under involuntary consent. Then minors like जैसे रेप केसेस होते हैं, इमीडिएट कुछ ऐसा होता है जो इलीगल होता है, तो वो under the age of 18 years of male or female, so that will becomes under the minor and major concern. And lastly forcible will be when the patient is very eager. जो client है जिसको चोट लगी, injured है, वो बहुत ज्यादा eager है, actively they are saying अभी करो, तुरंत जाओ, मुझे हॉस्पिटल जाना है, मुझे नंबर चाहिए, बहुत ज्यादा पैनिक कर रहा है, then it will comes to forcible. consent, or you can say the restraint. So right to refuse treatment is the first and last legal implications that we have to learn as a first aider, and patient have right to refuse if you are giving care and it is getting, patient is not saying they will not take, you have no authority to touch patient and to give care. That is our safety. So first we have to save, then only we can make a client safe. So encourage again and again for allow care, or allow them to sign and refuse care form, document or refusal and witness valuable in these situations. Then reasonable skill and care we should have, that is you do not have to create situation को और बिगाड़ना नहीं है, उसको और संभालना होता है. You should know how to plan the specific condition. अगर बर्न हुआ है तो उसका एक्शन प्लान क्या होगा, एयरवे प्रॉब्लम है तो उसका एक्शन प्लान, चोक हो गया है, सांस नहीं आ रहा है, उसका एक्शन प्लान हो गया. That we have to plan and we have to make it. So negligence or presume first aider knowingly against the casualty, aider intentionally risks the life of casualty. So life of casualty, we are playing with the lives. एक जान के साथ अगर हम खेल रहे हैं तो we are responsible for everything. So negligence is not accepted. So don't do negligence. And abandonment is the casualty. You know, once you start care, you should never leave. एक बार आपने care की, bandage किया, उसको hospital पहुंचाने का, और फिर वहां से आप भाग गए. So you should not do that. Is also illegal. So abandonment is also a bad in the first aider as a legal implication. Safety for the personal equipments, like whatever we are carrying with us, first aid kit, उसकी safety भी हमारी ही जिम्मेदारी है. Then confidentiality, patient को क्या हुआ है, we are the nurses, we are in wards, we are working in clinical area, what we are doing, एक AIDS patient आया, हमने बोला वो patient AIDS है, वहां मत जाना, एक दूसरे को बता रहे हैं, सबको बता रहे हैं. There is no confidentiality. So confidentiality is to be maintained. तो लॉ जो है समैरिटेनियन लॉ एंड ह्यूमैनिटी जो क्या कहता है, इट इज विदाउट एक्सपेक्टेशन और कंपेंसेशन, स्कोप ऑफ ट्रेनिंग एंड ग्रॉसली नेग्लिजेंस मैनर शुड नॉट बी अवॉइडेड. So it should not act in error or omission should not present in it. Then records and reports should be maintained, and ethical responsibilities like standards, your own and professional recording, reporting, we have to at last everything we did, but recording and reporting. आपने केयर दिया, आपने आईजी फीडिंग दी, सुबह एक बार फीडिंग होगी, फिर स्टाफ नर्स आई, फिर से उसने फीडिंग दे दिया, थोड़ी देर में क्यों, क्योंकि रिकॉर्डिंग एंड रिपोर्टिंग नहीं हुआ. So 20 ml of feed has been given, it has to be recorded, it has to be reported. So next feed will be after 4 hours, that should be recorded. So recording and report whatever care you have given, it should be on paper, then only it is have value, unless there is no value of any type of care you are giving to the patients. Then so thank you. Summary box is protection under law as safety, our safety, patient safety and other safety. Consent is very important, anonymity and liability. So patient rights and first aider rights, if you are awareing, you when you are giving care, then only you are safe, and first aider and patient is safe. Thank you. Thank you so much.
Thank you, ma'am, for your thought-provoking session. Your valuable perspectives have emphasized the need for teamwork, empathy, and holistic care in nursing practice. We are certain that your words will guide us in improving patient care and in strengthening our role as a future nursing educator and professionals. Students, this was our last session of today's conference. Ladies and gentlemen, as we draw the curtains on this international conference on next gen nursing education, excellence in modules, it is clear that today has been a day of inspiration, learning, and collaboration. Throughout the day, we have heard inspiring presentation, meaningful discussion, and thought-provoking insights that have broadened our perspectives and strengthened our commitment towards advancing nursing education and practice. On behalf of organizing committee, I extend our heartfelt gratitude to all the distinguished speakers, participants, delegates, and supporters who have been made this conference a grand success. Your active participation and engagement have truly enriched the event.
We look forward to seeing you online and continuing your productive dialogues. Thank you and wishing you all continued
बाबू ने खाना इनका कॉलेज आना मेरी फाइल करना मेरी ना कुछ नहीं करेगा मेरा ये देवर वायर में जान नहीं पाएगा कौन आया कौन नहीं कोई दो दिन रख सकता है ठीक है वो ना है मेरे तुरंत जान जाएगा वो आएगा उसको टाइम भाई तुम्हें कॉल कर दिया जानता लगा तो ये जानता है इसने किया तो लगाएगा टाइम कर देगा भाई को जानता है कल रास्ते में ट्रक ले लिया रोड के बीच में